Hi. We talked about AVN, avascular necrosis, last week. We talked about how it happens and what we go through as persons living with sickle cell. I want us to talk about the management of AVN. As you already know, you can't cure these things. With AVN, the one thing that I know about is you'll be able to do a hip replacement. They use titanium for the hip replacement. That's just one thing that I know that you can do to replace the old bad hip. But then most of us, we just use management. We just go through the management processes. The management processes, besides having a good physio, you can have a good physiotherapist that can take a good look at least 3 times a week or twice a week. That'll be fine. You can also decide to go through hydrotherapy. With hydrotherapy, you do movements in the pool. Within the pool, the section of the pool, you're able to do certain things that you are not able to do on land. I don't know, there's this thing about the pool that you're able to do. Some of the stretch, of the muscles, the nerves, you can do all that within the pool. We'll even talk about hydrotherapy probably in the next section. I want us to talk about heating parts. Heating parts is also another way you can use to manage it. It's like I keep saying, it's not going to go, but you're going to feel less pain, because it helps with the blood movement. With heating parts, it makes those blood that are not able to move through, through the blood vessels, be able to move a bit more. Once the blood are moving through the blood vessels, then you'll be able to do a lot of things. You'll be able to move around, because then you don't have too much pain because there's circulation in your blood vessels. So for me, I have few heating pads. This is an example of a heating pad. This is a heating pad. Yes, so this is another type of heating pad that you can also use. This is another heating pad. With this heating pad, you just put it inside the microwave for about depending on the texture. So you can just put in for 4 or 5, according to the texture. Because if it goes beyond it, then it can actually burn. So you just have to go within that section that you'll be able to take. So you can have 2 heating pads. You put one on your left, one on your right hip. And it brings the warmth, goes through the pores, it goes through the bone just to make the blood circulate a bit. For a while, the blood will just circulate around it for a while. So that you can use that, and that will reduce pain. Secondly, you can also use stimulators. This is an example of a TENS stimulator. So this is by TENS. And these are the parts that comes with. So with this part, you stick it to the area that the pain is. You stick it there and you just switch the TENS on. So wherever you place it, they have different segments. So you place it the place that it actually wakes up the nerves. Certain nerves, it gives attention to the nerves for the nerves to start, working as it's supposed to. So it brings attention to that and it wakes up all the nerves that are around that section, because all these things are things that helps relieve the pain. So you need a stimulator as well. Then as well, you need someone that will be able to come, or you can able to go there to to have your massages. So with this, the physiotherapist is the best person that will be able to massage the body with the way that it's supposed to go through. Yes. So these are just the few things I want to talk to you about, and how to manage AVN, avascular necrosis. Thank you very much. Bye.